There's this whole issue of sort of social distancing. I think being cognizant of where you are and perhaps avoiding, the grandson's football game or basketball game if you know there's going to be thousands of people there or hundreds of people or whatever. So I was just looking, and there's all this data now about comparing what happened. For example, I just saw this like literally a couple minutes ago in 1918, where Philadelphia didn't institute, early sort of quarantine type measures, whereas St. Louis did early on with when they found out first cases of the Spanish flu, and the epidemic in Philadelphia was much more significant than it was. So in St. Louis, and so. It probably might be seen as a little bit reactionary to do shut down all these sports games or all these concerts or all these meetings, bunch of oncology meetings that have already been canceled. But I suppose it's better to be overreactive than underreactive, and then a month from now regret it, right? So I think I support whatever the epidemiologists tell us is the right thing to do. But for the individual patient, wash your hands, then wash them again, and then hand wash again after you're done talking with someone or seeing someone.
What is essential and what is non-essential travel at this point, and so just I think protecting yourself is, preventing yourself from getting the virus is, I think, critical in preventing the spread to others, right? And so you should not be someone walking around like me. I should not be the one walking around, asymptomatic, but passing it on to others. And so I think the best thing that we can do in this situation is really to take care of ourselves first, and that, I think, ultimately, if we all did that, then that would ultimately help the community as a whole.
Lung cancer patients are exactly the high-risk population. They have lung disease, they're older, and our clinic, I had clinic yesterday, and our waiting room was packed with patients, and that's the worst conceivable, it's like a nursing home on steroids, right? It's the worst conceivable environment for passing around this virus. So I don't know what the solution to this is. I think we're just today reported in Ohio was a case of a man who hadn't traveled. He was 50 years old. He had no known contacts with the disease, but he must have gotten it from just someone in the community. So we're not talking about just people from China, or Italy or wherever. It's among us. But still, the fact is that 100 times as many people die of just regular influenza than die of this disease. So I think we need to study this disease. We need to come up with a vaccine. We need to do the best we can with standard precautions of hand hygiene and that kind of thing. And then hopefully within a year we'll have a vaccine and we can start immunizing people. But even the flu vaccine has been out there and people are still not getting immunized with the flu vaccine. So we have our work cut out.
I think it's going to be particularly challenging in the thoracic population because I feel like we already see issues like pneumonitis, pneumonia, maybe not as much in our EGFR patients, but a lot of patients with underlying COPD, underlying heart disease, because patients are smokers. So one of my big concerns is just that our patients are going to be at higher risk of being patients who have complications if they contract the virus. I think as oncologists, not being infectious disease doctors, probably the most important thing is to encourage our patients to do the things we already encourage them to do. Stay away from people who are sick. I think as this unfolds, I don't give patient-specific recommendations, but maybe avoiding crowds, maybe avoiding public spaces until we know a little bit more about how this is going to play out. I think some of the challenges we're going to face as oncologists is trying to stop people who maybe are ill from coming into our clinics and spreading it to other immunocompromised patients. But I think the big challenge we have is that our patient population is high risk, and how we can control infections in and around our clinics.
We have to be aware of the facts when dealing with an unknown pandemic. Obviously we want to prevent the spread of the virus, but we don't want to compromise cancer care. My advice is, if someone is scheduled for a lung cancer surgery and they're concerned about coming to the hospital to have their cancer surgery, I would think that the benefits of having the cancer removed far outweighs the minimal risk of getting viral infection from the COVID-19 virus. So I would recommend that people use good judgment, don't make decisions on erroneous information from the media. Talk to your doctor, get direct direction, instructions from your oncologist and your surgeon, and just make good, sound decisions based on facts.
I think we're all trying to learn what to do, the steps next. We're getting, here we are in mid-March, and there's constantly new information coming in, and we're trying to quickly adapt to the landscape. At my institution, we've moved to minimizing group meetings and person-to-person exposure times. So all of our tumor boards at the James Cancer Hospital have been changed to virtual meetings. In addition, all of our quality assurance checks in our radiation oncology department, what we call a chart rounds, has been moved to virtual meetings. So we're also canceling patient appointments for those who want to do that, particularly in the elderly. Patients are calling us to see if they can cancel. And if it's a routine follow-up, we don't have a problem, moving those follow-ups 1 to 2 months out, and that may be a help to reduce some of the burden with regards to number of appointments. But I think, the key is just sort of minimizing time, minimizing exposure to others, and being counseled on the right signs of potential infection, so that it intervening early can be prioritized.
Obviously, this is rapidly evolving, and we try to, absorb the information and the rapid communication as we try to extrapolate the data from the epidemiologic observations. It seems that it's clear that more susceptible patients to severe infection and maybe lethal are those who have some characteristics: the elderly, the ones who have significant comorbidities, and the immunosuppressed. And of course, in that category, a lot of our patients are included. So they, as a group, all cancer patients, especially those who are in active treatment and are immunosuppressed, they have to be more careful in try to minimize exposure.
We're getting a lot of those types of questions. Actually, I had a patient message me through the portal the other day, worried about this. He just got his second round of adjuvant chemo following a lung cancer resection, and he's worried about coronavirus. The best I can say right now is what we all know from reading the CDC guidelines. It's, be smart. If you're immunosuppressed, take precautions, follow the travel advisories and other precautions that have put out. I don't think there's anything special at this point we would offer. Don't panic, just follow the advice. And, I think that, like many things we've encountered in our healthcare system, this will, pass with time.
Of course, I do have some concern. Obviously, everybody is concerned. Actually, I want to remind you, back in 2009, when we have H1N1 flu, the FDA published data 3 years later, so the mortality rate was 2 to 3%. In the US population, actually was as high as 20 to 30% outside the US. Based on the result from China, I think the mortality rate actually, if anything, is much lower than H1N1 flu. I do think it's a concern, in particular for lung cancer population. And this virus seems to have preference to target lungs. and causing ARDS, and sometimes almost give cytokine release syndrome-like picture, requiring intubation.
Standpoint, the only way it affects radiation patients is that if you have side effects from radiation or you have an infection, you can't tell one versus the other, and so it's always confusing. At that point, you have to like really be diligent about testing. You have to be really diligent about looking where your fields of radiation were, because could it be related to the radiation, and that's kind of how it interacts. The other thing is that radiation is immunogenic. It has been used in some viral vaccines have been used for killing cancer in combination with radiation, and that's an interesting area, an interesting approach. Of course, not applicable to the coronavirus, but in general, that is an approach that we are looking at, and hopefully we will have future trials to prove or disprove the combination therapy.
You know, some of these patients are on treatment and are immunocompromised, so I do think it's reasonable to try to stay away from areas where we're hearing a lot about the coronavirus. I'm just, you know, just from my own reading and looking at the news, I'm just advising people just to do a lot of good hand washing and to try to, you know, just avoid crowded places and to, you know, I fear that if, you know, too many people become too afraid and go to the hospital, that we could, you know, overwhelm some of our healthcare systems, especially with a lot of people that may not be that sick, and that might be, you know, just another nidus for spreading, you know, the virus. So if people aren't too sick, you know, just staying at home.
We know that the patient populations that are being most greatly impacted, the most critical illnesses from the coronavirus is our elderly patients, which we see a number of in the community and oncology practices, and also immune suppressed patients, which is a concern for our field. So we work in a field of patients that have concerns. Right now we're taking implementations to improve hygiene as much as possible. We're taking some practice parameters to try to decrease the risk of spread. But it is a concern, and a hard part is that many organizations and institutes, one of the practice implementations is to avoid going to places if you have symptoms of illness such as fever. But for our patients, it's very important that we evaluate those patients that may have infections and life-threatening infections that need treated. So I think it'll be a challenge, but I think it's very important to have awareness, education, both for us and for the patients, and to try to limit the disease spread as much as possible.